Danielle and welcome to my training video on ergonomics for nurses and healthcare workers. In simple terms, ergonomics is to design a job around the physical abilities of the worker. The main goal of ergonomics is to reduce work-related musculoskeletal disorders, which are common in healthcare-related jobs. Nurses have a 2 times higher chance of a work injury than most jobs. This is because clinical staff spend a large portion of their day moving and transferring patients, both conscious and unconscious. Nurses lift an average of 1.8 tons per shift per day, making injury high in this profession. It is important for organizations to teach proper ergonomics and body mechanics to all workers for their safety and satisfaction. The many benefits of ergonomics include decreased injuries, illnesses, and worker compensation costs, increased efficiency at work, increased physical well-being, decreased absenteeism and turnover, and increased employee morale. Ergonomic programs are designed around the safety of the employee. When lifting multiple times a day in various scenarios, the risk of an injury is high. It is important to remember that it is not the number of lifts, but rather how you lift that will affect your patient's safety. The safety of both you and the patient are at risk when lifting alone or using the improper body mechanics. Following these 5 simple rules are vital when dealing with lifting patients. Rule number 1, keep a flexible spine. A rigid spine is easily injured when lifting or twisting the body in rapid and continuous movements. Be sure to mind your power lifting zone between the hips and the shoulders, making sure to keep the load distributed evenly in front of your body. Keeping your ears, shoulders, and hips in line will keep the spine straight. The main idea here is to protect your back. Rule number 2, have a comfortable stance. Keeping your knees bent rather than your back will prevent injuries. Having your thighs and knees remain flexible will take the stress off the back. Keep feet spread apart and stretch throughout the day. Rule number 3, keep load close to the body. Lifting away from the body makes the patient heavier, but keeping them close to your core will give you and your spine more strength to lift. This will allow you to comfortably turn your body rather than twist. Rule number 4, never lift alone. Unless the patient is able to assist, clinical staff should never attempt to lift by themselves, especially with a fallen patient. The injury risk is much greater when lifting by yourself. This can cause overexertion on an individual body. Call for help in these situations to avoid injury to both you and the patient. Rule number 5, create patient lift teams. The definition of a lifting team includes 2 physically fit people competent in lifting techniques who work together to perform high-risk patient transfers. Lift teams are assigned to a select few well-trained nursing staff. Selection of lift team members is based on individuals with no prior history of a musculoskeletal injury and is dependent upon their physical strength and capabilities. Once selected, they are trained on the use of mechanical lifting. The significance of a lift team is evident by the elimination of critical risk factors that contribute to nursing back injuries, such as lifts that are uncoordinated, untrained lifters, and already injured nurses. It is important to remember these 5 steps when lifting patients. Number 1, keep a flexible spine. Number 2, have a comfortable stance. Number 3, keep the load close to the body. Number 4, never lift alone. And number 5, create patient lift teams. Patient lifting is an unavoidable situation in a clinical care setting. Be sure to follow these 5 simple steps in addition to the guidelines set forth by your facility. Ergonomic programs are designed to protect yourself and improve your ability of helping others. Knowing your own strength and the proper body mechanics will make patient lifting a safer and more efficient task at work. Be sure to ask management of the lifting policies and procedures in place and be a leader among your coworkers in promoting safe patient lifting and ergonomics.